Good morning. I'm Jessica Covington, KHA Quality Program Pharmacist. This year, I'll be focusing on hypertension to bring awareness to Kentucky hospitals about this silent killer. Hypertension damages the blood vessels over time that leads to threatening disease states, which affects the quality of patient lives, as well as places a burden on our healthcare system. When your blood pressure is high for too long, it damages your blood vessels. The LDL, which is the bad cholesterol, begins to accumulate along the tears of the artery walls. This leads to narrowing of the arteries and increases the workload of the circulatory system while decreasing its efficiency. As a result, high blood pressure puts the patient at greater risk for developing life-changing and life-threatening conditions. Left undetected or uncontrolled, hypertension can cause heart attacks, strokes, heart failure, kidney disease, sexual dysfunction, vision loss, peripheral artery disease, and angina. In fact, the number of visits to emergency departments with essential hypertension as the primary diagnosis is 1.3 million people based on the National Hospital Ambulatory Medical Care Survey in 2021. So why does this matter? All of the disease states increase the risk of readmissions to your hospital, which means unhealthy patients with a decreased quality of life, an increase in healthcare cost, and potential withholdings of dollars to your institution if your patient is readmitted within a certain time frame. Not to mention, the CMS star ratings are at risk every time a patient is readmitted. Health equity plays a major role in hypertension. Using electronic health record data and resources in the community to identify populations and communities with the highest rates of disparities can help your facility focus on intervention for those most in need. Changes in healthcare systems, such as protocol-driven and team-based care, have been shown to improve hypertension control across many different population groups. Hypertension control can be affected by social determinants of health. As we all know, living a heart-healthy lifestyle is a foundation of hypertension control, which can be nurtured through community support. Lifestyle changes that support hypertension control include physical activity, adopting a healthy diet, not smoking, and maintaining a healthy weight. These actions are more easily implemented when they are a part of everyday life. Health is determined in part by where we live and spend most of our time, such as school, work, and home. Clinical guidelines for blood pressure management highlight the importance of non-pharmacological interventions and lifestyle change to improve cardiovascular health. Community-level strategies that change the environment where people live, work, and play, such as increasing low-sodium food options, opportunities to buy healthy foods, especially in low-income neighborhoods, and also improving school nutrition and food assistance programs. According to the CDC, when looking at hypertension prevalence in adults age 18 years and older within the U.S., as you can see, the southeastern states have a higher age-adjusted hypertension prevalence of around 42 to 59%. We have work to be done in the United States, so much that the Surgeon General's call to action to control hypertension, to heighten awareness and provide strategies and resources to reach the goal to control hypertension. Let's take a deeper dive to see how our state compares with the rest of the United States. As you can see, a close-up on the state of Kentucky reveals we have a lot of dark red counties spread throughout the state, with parts of our state having hypertension prevalence of greater than 43%. We have a lot of work to be done across our state to reach our goal of controlling hypertension. So why does hypertension matter to our Kentucky hospitals? According to the U.S. Department of Health and Human Services, almost 1 in 2 adults have hypertension, and only 1 in 4 people with hypertension have it under control. This places millions of Americans at increased risk for heart disease and stroke, which happen to be the first and fifth leading cause of death in the United States. Patients are coming through our doors daily that may have undiagnosed or uncontrolled hypertension, in which you may be the first provider that the patient has seen. It's good to have an awareness of the silent killer as you see patients on a daily basis. I look forward to working with you throughout the year on all things hypertension. Please think about your facility and what your facility is doing to screen these patients at risk. Consider sharing resources and protocols that have or are being developed to help your facilities reach the goal to control hypertension. Again, my name is Jessica Covington, the KHA Quality Program Pharmacist. I've provided my email for questions and sharing of resources. Thank you for your time, and I will see you next month.